Welcome to the Duke Eye Center. We are located in Durham, North Carolina on the campus of Duke University.
Welcome, 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 welcome to the Duke Eye Center.
The Duke Eye Center has 600 team members. Some team members work with patients in clinics, and others work on new and exciting eye research, which guides how we treat eye diseases. Some of us do both. Each year, many new trainees join us as they pursue careers in medicine, ophthalmology, and research. And each year, we see 200,000 patients and perform 14,500 surgical procedures to preserve and save vision. We invite you to follow along with us as we show you around our clinics where we care for our patients and give you a special behind-the-scenes look at our research labs where we do some of the most advanced eye research in the world. As patients enter, they check in at the main registration desk and are directed to the correct clinic. There are 10 different divisions and centers within the eye center, each specializing in a different part of the eye. Comprehensive adult care, cornea and refractive surgery, glaucoma, pediatrics and neuro-ophthalmology, vision rehabilitation and sports vision, oculofacial surgery, vitreoretinal disease, and ocular immunology. Patients wait in one of our waiting areas to be called in to begin their eye exam. A certified ophthalmic technician greets the patient and starts the eye exam. Ophthalmic technicians play a very important role at the eye center. They are the first clinical member to work with patients, gathering important data about the patient's medical and eye history, along with completing initial testing like measuring vision and eye pressure. To begin the exam, measurements may be taken with an autorefractor like this one. It uses light reflections to estimate the focusing power of your eyes. A lensometer is used to measure the focusing power in glasses lenses. Next, the ophthalmic technician will perform testing in the exam room. They will measure things like visual acuity, which is how well a patient sees at distance and near, color vision testing, examination of pupil responses, and eye muscle function. Patients have their prescription measured with a phoropter. Multiple lenses are tested to determine the best ones to maximize vision. The front surface of the eye, called the anterior segment, is examined under the slit lamp microscope. This includes eyelids, eyelashes, the sclera, conjunctiva, cornea, iris, lens. Eye pressure, or intraocular pressure, is also measured. This is important for everyone, but especially if you have glaucoma. Eye drops are used to dilate the pupil. They also relax the eye's focusing system. This allows a thorough exam of the back part of the eye, called the posterior segment, or fundus. The drops take a while to work. Once the pupils are dilated, the doctor can take a close look at the structures in the back of the eye, the optic nerve, blood vessels, and retina. This part of the exam tells the doctor about the health of the eye and can also detect other diseases like diabetic retinopathy. The doctor may need extra images of the eye to determine the diagnosis and best treatment plan. Our ocular photography team helps obtain this vital information. Images like these are obtained and carefully reviewed. Once all the clinical information is gathered, the doctor can determine the best treatment. Treatments may include glasses, contact lenses, eye drops, injections, laser procedures, and surgical procedures. At the Duke Eye Center, some surgeries are performed right here on site in one of our 6 operating rooms. Our surgical team includes our doctors and trainees, nurses, anesthesia team, pharmacists, operating room technicians, and a team of staff who clean and prepare all the instruments and supplies we need to do our surgeries. At the Eye Center, we all work together to provide the most advanced treatments. But how do doctors know what the best treatment might be? A large part of what we do at the Eye Center is teach the next generation of doctors and researchers. We have medical students, residents, and fellows who train in our clinics and operating rooms for several years before heading out to practice independently. They attend lectures, teaching rounds, and practice in the lab. Our job is to support and prepare them for the next step of their career. We also have graduate student researchers who work closely with Eye Center vision scientists, learning to perform experiments and training to be the next generation of vision scientists. Medical research happens both in the clinic, called clinical research, and behind the scenes, called basic science research. Both help doctors decide how to best treat patients. There's always something new to learn, and a lot of that research happens right here at the Eye Center. Next, let's take a look inside the Albert Eye Research Institute. It's a 4-story building dedicated to eye disease research. Let's take a look inside the labs. Each floor looks almost exactly the same, a U-shaped open space with desks and benches at the outside where we do all experiments. It's COVID time, but usually there's 1 person per bench. A very important room is the tissue culture room. Let's get in. In the tissue culture room, the eyes or tissues that we receive from eye banks, operating rooms, or even the slaughterhouse are dissected, like this one. This is a pig eye. We isolate and grow cells. Here, a researcher is feeding cells. The red liquid contains culture media, which carries the nutrients needed. We keep the cells in these incubators for days and even months. This is a selfie of a cell. We stain the cells with fluorescein proteins to distinguish their organelles. Cells and tissues can also be frozen and stored in these ultra-freezers for years. This undergraduate student is slicing frozen eye tissue in a microtome. This process is called cryosectioning. The tissue is embedded in a gel and quick frozen. You can see the round dot in the white block. That's the tissue. It is sliced very carefully into very thin slices and collected as cryosections on slides. We are then ready to stain the tissues with fluorescent dyes and observe their structure under the microscope. Here, Dr. Madala is studying a confocal image of a mouse eye. Here, Fiona, one of our researchers, is getting ready to go to the Physiology Room. The Physiology or Perfusion Room contains state-of-the-art equipment, microtomes to section optic nerves, and eye perfusion systems where we can test drugs for the treatment of glaucoma. We can visualize the effects of the drugs with one of our several imaging systems. The Eye Center Research Group is comprised of 103 team members, all working together in a multicultural and diverse environment to perform cutting-edge eye research. A lot of amazing things happen at the Eye Center each day. From clinical care to new research breakthroughs, we work together as a team to help our patients achieve their best vision. Thank you for joining us for a tour of the Duke Eye Center. We look forward to seeing you in the future as a patient or as a member of our team.